You're listening to Health Professional Radio with Wayne Buckler. My guest today is Heather Allan, the CEO of Lung Foundation Australia. And Heather joins us today to tell us about the work of the foundation. Hello to you, Heather.
Hello, thank you for having me.
It's a pleasure to have you on with us. Tell us about Lung Foundation Australia.
Well, Lung Foundation Australia is a national not-for-profit, and our job is to make lung health a priority in Australia. In Australia, we are all conditioned to think about our heart health, our breast health, our skin health, but we're not thinking about our lung health. And we know this because when we've surveyed patients or their community, we know that about 37% have never or rarely think about their lungs. So this means that for many people, they may be missing early symptoms of lung disease and not seeking medical advice and therefore taking important steps to manage their condition. But we're also not just about awareness. We are here for patients once they are diagnosed with a lung disease by being a credible source of information and resources for anyone with any lung disease or anyone who may be concerned about their lung health.
Now, Heather, are you an Australian-wide organisation?
We are Australian-wide. We are based in Brisbane, but we offer services nationally. We offer services for people with lung disease by being a one-stop shop, if you will, for people to call us on our 1-800 number, contact us via our website, which is www.lungfoundation.com.au, or through our email information link. And we're here to provide information, whether it's a small flyer on a lung condition, right through to complete guides on how to manage and live with chronic lung disease.
Now, Heather, you mentioned the 1-800 number. Can you just give it to me while people are thinking about it?
Yes, it's 1-800-654-301.
I just thought we should mention that since it came up with the website. Now, a friend of mine who dealt a lot with, as a surgeon, with lung cancer said if lungs were on the outside instead of the inside, no one would ever smoke ever again. I can understand why you say that our lung health doesn't kind of rate highly. What's the message that you'd like clinicians to take away from hearing you today?
Well, clinicians who are listening should consider the Lung Foundation as a secondary support to them and their patients. People living with a lung disease or a lung condition live with that condition every single day of their lives. They may see their specialist once every 6-9 months. They might see their GP once every 2 or 3 months. But the Lung Foundation is here to support those patients who live every day with their condition. And our job is to empower those patients by making sure that they understand their lung condition, by providing education about how the lungs work and about the various conditions that are out there. And importantly, the very critical role that the patient has in managing their lung disease. They can learn tips of how to handle symptoms of lung disease, breathlessness and cough, understand how to recognize when their condition might be worsening and when it's important to seek medical attention. What tips on how to live and exercise with their lung condition. Exercise is an important element for most people with chronic lung disease to ensure that they get the best quality of life that they can with their condition and improve their strength and ability to carry out their activities of daily living.
You're listening to Health Professional Radio. My name is Wayne Buckler, and my guest today is Heather Allan. Heather's the CEO of Lung Foundation Australia, and we've just been discussing the role of Lung Foundation Australia. Heather, is there a formal referral process, or can patients self-refer? Can, in fact, clinicians and staff just pass your number on to patients, or is there a referral process needed?
There's no referral process needed at all. And in fact, if there's a message to give to clinicians who may be listening, it is to ask their patients, have they called the Lung Foundation yet? Call the Lung Foundation on 1-800-654-301 and find out about local services that might be available to that patient. The Lung Foundation has exercise programs around the country called Lungs in Action that we can put patients in touch with. pulmonary rehab programs, all sorts of community services that will be available to patients. So encourage your patients to call the Lung Foundation and find out what's available for them.
Now, Heather, I notice on your website the Lung Health Alliance. Can you talk to us about that for a moment?
Yes, there are a number of organizations that work in the lung disease and lung health space. The Asthma Foundation, the Thoracic Society, which is the professional body, cystic fibrosis, and of course the Lung Foundation. The Lung Health Alliance was designed to bring us all together so that we can speak with a louder voice, particularly with government. In past times, we would all be going to government and speaking to them about our particular areas, and governments were getting a little confused about the messages coming to them. So the Lung Health Alliance was designed to get us all working together and speaking together with to increase government support for lung disease across. And in particularly, one of the issues that we have gone together with is to support money coming into research into lung disease.
Yes, it is a fact of life, whether we like it or not, that government does like to deal with high-level bodies and as few as possible if it can.
Well, that's right. And while the Lung Health Alliance isn't another body, we were very careful not to create another body. It was an opportunity for us to all work together, understand what each of our priorities are, and where our priorities think that we work together on those issues.
Now, Heather, my favourite question in every interview is about misconceptions. There's misconceptions in everyone's work and in every field. What's the biggest misconception you find amongst clients, patients, clinicians, the people you work with, about your field that drives you nuts and keeps you awake at night?
Well, I guess what really drives me nuts and keeps me awake at night is the stigma that those living with lung disease face every day. There's a perception in the wider community that lung disease is smoking related and therefore somehow not worthy of support, whether it's government support, community donations, or even media coverage. And there are a few things I'd like to say about that. Firstly, no one deserves lung disease. Secondly, an important thing to say is that there are many chronic diseases out there, and in fact I would argue that most chronic diseases have a lifestyle aspect to them, that people have made a lifestyle choice that have affected their chronic condition. Yet I don't think they face the same level of stigma that I know our lung disease patients face every day. The other important thing to say is that not all lung disease is smoking related. 30% of women with lung cancer have never smoked. About 10 to 30% of those who have COPD have never smoked. And there are probably 30 rare lung diseases that affect children who clearly have never smoked. So it's important to say that lung disease doesn't discriminate. It's an equal opportunity disease. It affects young, old, smokers, non-smokers. So if I could change something, I think it would be the level of stigma that is out there for people who are diagnosed with lung disease.
Let's hope that we've helped with that misconception just a little bit today with our audience. Heather, let's mention the website and the phone number again, because I'm always getting into trouble for not giving people time to get their pencils ready when I mention phone numbers and websites. So fair warning, listeners. The website again, Heather, was
www.lungfoundation.com.au.
And the phone number?
1-800-654-301.
Thank you for that, Heather, and it's been a pleasure having you with us today. It's very clearly a subject about which you're passionate. I can hear the passion in your voice when you speak. So thank you for your passion on behalf of patients, and thank you for your time.
Thank you very much, Wayne.
My name's Wayne Buckler. If you just missed my conversation, I've been in conversation with Heather Allan. Heather's the CEO of Lung Foundation Australia, and we've been talking about the work of the foundation. But the good news is a transcript's available on our website at www.hpr.fm, or you can listen to the SoundCloud archive or the YouTube archive, both of which are available from our website. Search for Lung Foundation Australia, and you'll be able to listen to the whole interview again. You're listening to Health Professional Radio. My name is Wayne Buckler.